All right, well, welcome back everyone. Let's go ahead and dive into part two of this lecture series. For this one, we're going to focus on kind of dehydration and rhabdomyolysis, which is associated with exercise and exertion. So let's go ahead and get started with dehydration. So quite simply, dehydration is kind of similar to hyperthermia in that it's just an imbalance in regards to hydration status as opposed to core body temperature. So what we actually see with dehydration, by definition, it is when your fluid intake is less than the amount of fluid that you've lost. So when we talk about being in a hot environment and we talk about exercising, there are really kind of two primary methods by which we're losing a lot of fluid. So the most where we see the greatest water deficit is from sweating due to thermoregulation. So we talked about the importance of sweating and how that's kind of our main method for dissipating heat via evaporation. So most of the fluid loss that we see is going to result from sweating. We do have this other thing called insensible loss, which is through respiration. So as we breathe, we end up losing fluid when we exhale. And this is usually not very substantial. However, it can be very significant when we travel to high altitudes. So if you're doing any high mountain alpineering or mountaineering, this can result in as much as 1 to 1.5 liters lost per hour. So that can be very significant. In general, when we're at normal altitude, it's going to vary as a result of humidity and things like that. But usually, the amount of water that we lose through respiration is usually about equal to the amount of water that we gain from metabolism. So when we break down carbohydrates and things like that, we just through that chemical process, we actually release a little bit of water. And so those two actually usually cancel each other out, the exception being at high altitude. So in general, we're more worried about water loss through sweating. It's been shown that dehydration can definitely have an impact on exercise performance and thermoregulation, so our ability to mitigate heat illness and things like that. Usually, we have these issues at more than 2% of our body weight lost through dehydration. So, mild dehydration, not really going to play a big factor. We start seeing these changes occur at around 2% body weight. It's usually between 3 to 5% body weight when things get significant, but we can actually tolerate a decent amount of dehydration. So just think about that. So take your body weight, take 2% of that, and you can lose that amount of water and still be doing okay. Sweat rates vary from exercise, the activity at hand. As we mentioned before, it also kind of depends on your level of acclimation to the heat. So the more acclimated we are to the heat, the more we're going to sweat. But in general, when you look at various activities, a lot of studies have shown that your sweat rate is going to vary between 0.5 to 2 liters per hour. Again, that's going to change due to the activity. It's going to change to your genetic predisposition, your general level of fitness, as well as the environment that you're exercising in. So the temperature, humidity, elevation, all those things are going to come into play. So when we look at dehydration and what actually happens, there's a number of things that are going to result when we have significant dehydration. So things that we're worried about when we have decreased renal blood flow, so that's blood flow to your kidneys, you can actually have kidney injury. When we have decreased blood flow, or when we have decreased volume status, we're going to have decreased blood flow to our muscles, which is important when we're thinking about exercising. Those muscles need good perfusion, they need good blood flow in order to function at that level of exertion. So we're going to have decreased blood flow to the muscles. We'll talk about the complication that occurs with that a little bit later. Decreased cardiac output. Remember that when we have heat stress, one of our responses is to increase our cardiac output to try to move more blood and dissipate more heat. When we don't have as much fluid status, when our fluid status is diminished, we're going to have decreased cardiac output. Our heart isn't going to fill as much with each contraction. It's not going to move as much blood. We're not going to be able to compensate as well for the heat. We're going to have decreased cutaneous blood flow and decreased sweating. So cutaneous being kind of to your skin. And so decreased blood flow to your skin, decreased sweating means greater heat accumulation. Remember that we mitigate heat by increasing blood flow to the skin and increasing our sweating. When we don't have the fluid present, we can't do either of those. We're going to have more heat accumulation. We're going to have greater susceptibility to heat illness. And ultimately, this last one gets a little scientific. Increased osmolality. This just means that your cells are going to dehydrate. They're not going to function as well. So I don't want to get into renal physiology. Your kidneys are extremely complicated, but I think that this picture has some really important points that you need to know about. So dehydration, the effects on the kidneys. This is kind of a diagram depicting the interface between your blood, your capillaries. So these are little capillary beds, and your nephron, which is the functional unit of your kidney. So this is kind of where your blood meets your kidneys and how those two work together. What I want you to know is that blood flow to your kidneys is important for kidney function, and there's a couple things that can affect this. So over here it says that this afferent, so the blood flow to the kidneys can be affected by NSAIDs. So ibuprofen, which is a very common over-the-counter medication that we all like to take when we're really sore. NSAIDs can drastically influence your ability to move blood into your kidneys. So what that means is that if you're someone who's already in trouble for kidney injuries, say you've been outside, you've been hiking a lot, you're super dehydrated, ambient temperatures 100+ degrees out, humidity's low, and you're really dehydrated, if you take ibuprofen, you're going to drastically increase your risk for kidney injury. And believe me, you don't want to injure your kidneys. It's bad news. Over here, this one might kind of more apply to your medical screening for people that you're going to take out in the mountains. ACE inhibitors are medications that people sometimes take for high blood pressure and cardiac illnesses and things like that. ACE inhibitors are also going to increase the likelihood that you're going to have kidney injury when you're dehydrated. And then ultimately, this little bottom bullet point, I don't know if you can really read it, but both these mechanisms can be overcome by severe hypovolemia. So remember, hypovolemia, low volume status, this is what we're talking about when we're talking about severe dehydration. So all these mechanisms that maintain good kidney function, maintain all those positive things that your kidneys do, they're going to be overcome by dehydration. They're going to be even more worsened by NSAIDs, so ibuprofen, things like that, and ACE inhibitors, prescription medications such as that. Something that you should keep in mind. Okay, signs and symptoms of dehydration. A lot of these are going to be pretty obvious to you guys. Weakness, dizziness, you've all probably had that where you're pretty dehydrated. You stand up and you get all woozy. That would be called orthostatic hypotension. So when you stand up, you become hypotensive just because you don't have as much blood flow. Your cardiac output is decreased. Nausea, vomiting, increased thirst. So if you're dehydrated, you're probably going to be a little thirsty. Your oral mucosa might look like this dry desert landscape, so really, really dry. Also, your skin might be very, very dry. Decreased urine output, and more specifically, darkened urine, so it might be that really dark yellow. You've probably experienced that before. That can be indicative of severe dehydration. Decreased body weight. So that's not really one that you're easily going to be able to tell in a wilderness environment. I don't think any of us are carrying out these very precise scales into the backcountry, but just know that a lot of times when people are actually assessing dehydration, say in ultra endurance events, if they're doing some kind of research, some of these events just measure this in their participants, but your body weight at the start of the event and at the end of the event is going to be decreased over time. All right, so let's talk about prevention and treatment of dehydration. Really, the key here is prevention. So you really need to ensure proper hydration before your activities. That means at least 24 hours before you go out for your big day, you start drinking water because there's really that fixed amount, that fixed absorption rate that we can't overcome. It doesn't really help to just try to chug a bunch of water the morning of your event. You need to drink adequately beforehand so that your tank is full and that you're ready to go. During activity, you want to try to maintain hydration, so probably the best practice out there is to just drink to thirst. So anytime you feel thirsty, just drink a little bit. Don't overdo it. We talked about the issues with that a little bit beforehand. Keep in mind that fluid absorption occurs at around 450 to 700 milliliters per hour. We can't really absorb more water than that. And also keep in mind that this number can actually be lower when we're actually exercising because we have decreased blood flow to our gut. We're moving more blood to our muscles and to our vital organs. We don't have a whole lot of GI activity when we're exercising, so this can be even less. So what that means is that you should adopt what's called a partial replenishment. So what that means is that throughout our activity, yeah, we're trying to drink water, we're trying to curb our dehydration a little bit, but where rehydration really happens best is when we're not exercising and when we're eating meals. So we actually hydrate best when we're taking in food with the fluid. So during meals or during snacks, things like that. We should ensure good sodium, potassium, and carbohydrate intake as well. So, some sports beverages can be pretty good for that. Things like Gatorade, the issue with them is that they contain a lot of glucose, a lot of sugar, and so that's good for replenishing the sugar that we need. But what you actually find is that they're just too sugary. They're too concentrated in the sugar, and that can actually make hydration a little bit more challenging. Better sports beverages to consider would be things like Endurox or Hammer or GU, things like that. Those contain what's called maltodextrin, which replenishes more carbohydrates but doesn't have the same issues with just straight simple sugars. Consider things like that. They really do work better. As far as management goes, it's pretty straightforward. We're going to give oral fluids until they're no longer dehydrated, so the symptoms resolve, their urine starts looking more clear. This again is going to work best when the person's resting, so we want to cool them down, calm them down, and rest. And keep in mind that fluids should be either mixed with some type of electrolyte solution, those same sports beverages that we talked about before, or taken with food, with snacks, things like that. That's when hydration really happens the best. I have this little diagram here. A lot of people are worried that caffeine is going to significantly dehydrate you. You've probably heard that caffeine will increase your urine output and dehydrate you. If you're someone like me who just can't function without a little caffeine to start my day, you can sleep easier knowing that the dehydrating effects of caffeine are not significant. If you enjoy caffeine during your activities, then you should keep doing that. It's not going to affect your performance. It's not going to further your dehydration. Studies have debunked that myth. So that's good news for people like myself. Let's move on. Rhabdomyolysis. So you've probably heard about this. It's received a lot of attention in the past couple of years, especially with CrossFit becoming kind of a new fad in the exercise world. So rhabdomyolysis, we'll just go ahead and break down this word over here. So rhabdo, myo, so myo means muscle. Rhabdo specifically means your skeletal muscles, so the muscles that like your biceps and your thighs and your abdominal muscles, things like that. And lysis means to break. So by definition, just breaking down the word, this means that we're breaking our muscular cells. What happens is we damage the muscles, and as they break, they release all these bad substances into our bloodstream. So normally the things that live in our inside of our cells should stay in our cells. When we damage these and they leak all these things in the bloodstream, that's when we end up with these complications. So how does this happen? There's a lot of different ways that rhabdo happens, and I've kind of bolded the three that really apply to this discussion. So drugs and toxins, there's a number of different drugs that will cause you to go into rhabdo. Significant trauma, so if you have someone who's got this big gnarly bruise on their thigh, they've damaged their muscle. They have the potential to develop rhabdo because all those muscle cells are leaking out those bad electrolytes and those bad toxins, proteins into the bloodstream. Seizures, so significant seizure activity, because you have so much muscle contraction and so much muscle activity, it can actually break your muscle tissues. Strenuous exercise. So when we exercise, the whole goal is to actually tear up our muscles a little bit so that they regenerate stronger. If you go a little bit too hard, if you decide that today is the day you want to start exercising and you just start doing a ton of CrossFit, which is kind of what we saw a couple of years ago, then you're going to overdo it, and you can certainly damage your muscle too much and cause yourself to go into rhabdo. This can happen when you're out, on a really long hike. Certainly that type of strenuous exercise can precipitate rhabdo as well. Dehydration, so when we have decreased blood flow to those muscles that we talked about earlier, you're going to have a greater likelihood for having muscle damage and breaking those cells open. So dehydration can absolutely lead to rhabdo. Additionally, heat illness, having that additional heat stress, can cause those proteins to break and to release the contents of the cells. We already mentioned seizures. I don't know why that's on this list twice. Electrical injury. So you can see this with lightning. It's not that common. Normally, in regards to electrical injury, this is more so when we grab onto a high voltage power line. That can cause rhabdo. And then crush injury. So a boulder lands on your leg. It's breaking all those cells. You pull that boulder up. You're going to release all those bad toxins in your bloodstream. So crush injury can result in rhabdo as well. So what actually happens? What are the complications that we see? So you've got all these proteins within those cells that when they enter the bloodstream, they're going to go to your kidneys and they're going to clog up those really fine little tubules within your kidneys. So you're going to have renal failure and renal injury. So that's one of the major complications of rhabdo. Rhabdo is something that can absolutely kill you, but if it doesn't kill you, it might leave you with long-term complications. You might have to be on dialysis for the rest of your lives. So people that have really bad kidneys that just don't work enough or don't work at all, they have to go in regularly to these dialysis clinics where they start these intravenous lines to pull out the blood and filter out all the bad stuff and run the blood back in, essentially doing what your kidneys should normally do for you. So renal injury, renal failure, really bad complication of rhabdo. Additionally, we have electrolyte abnormalities. Essentially, we release a lot of potassium into the bloodstream, and that potassium in very high concentrations is really bad for our heart. So it can cause our heart to go into really bad rhythms that can be lethal. And then compartment syndrome. So we talked about compartment syndrome in our orthopedic lecture. So basically, because of all the muscle damage, you have increased pressure within the compartments. This can further reduce blood flow, further worsen muscle damage within those compartments, and can ultimately lead to extremities having to be amputated. Most common in the lower extremities, so the shin, and as well as the forearm. So we see the forearm commonly in Army recruits and in people that are just doing too much weight training. Lower leg compartment syndrome more common in endurance events, hiking, really long distances, things like that. Clinical features that you might see. So pump over here is kind of a nice mnemonic. So pain of the affected muscle group. When we have significant muscle damage, it's going to be very painful. Urine. So your urine is going to be darkened. It's going to be decreased. And when I say darkened, it's not just this IPA or pale ale, kind of dark yellow. We're talking Guinness. So all these proteins are going to go into your urine and it's going to make it look brown or black. That's really, really bad. That's this person definitely has rhabdo and they definitely need to go to the hospital to have that flushed out. Myalgia, so that's just muscle soreness. And then the last P here is physical exertion. So all these things tend to happen in the setting of physical exertion or some of those other causes that we talked about earlier. Another common clinical feature is really, really bad muscle cramping. So this is probably due to those electrolyte shifts that we have when the muscle tissue is damaged. But in my experience, when I've had patients with really, really bad rhabdo, they just get really, really, really bad muscle cramping in those muscles that are affected. Management of rhabdo. So you're going to want to discontinue the exercise, discontinue exertion, because that's only going to make matters worse. You want them to hydrate, so give them a lot of water. You're going to basically hydrate them until their urine starts looking less like Guinness. Keep them cooled down. So remember, heat injury and heat stress is going to worsen the rhabdo. So cool them down, calm them down, get them out of the exertion. Evacuation, so they need to be evacuated. So, if this is someone who can self-evacuate, maybe have them hike really, really slowly. Don't let them carry their pack, so you should carry their pack if possible, or carry some of their stuff and leave some of the stuff behind. But don't work them too hard. Let them go at a nice, easy pace. Just make a little progress. Some situations you might actually have to get an organized rescue underway. So certainly at the Grand Canyon, we fly people out by helicopter because we're concerned about rhabdo all the time. It is life-threatening. It is a true emergency, so keep that in mind. And more hydration. I can't emphasize this enough. When we get these patients to the emergency department, and oftentimes they end up in the ICU, in the intensive critical care unit, they will get lots and lots of IV fluids. I'm talking like 10 liters of IV fluids over the course of their treatment before they start to normalize. The whole idea is that we're trying to flush out all those toxins, we're trying to dilute them, and we're trying to get a lot of blood flow to those kidneys so that they don't get super clogged up. Really, really important. So hopefully that should give you guys a good idea of how dehydration and exertion kind of fit into the heat illness and all the different things that go on. If you guys have any questions, please let us know, and we'll chat more at the practical session. Thanks.